I'm Daniel Levine, and this is the Bio Report. The year 2014 was one for the record books for the biotech industry. In part one of a two-part podcast, we take a look back at the year that was with Adam Feuerstein, senior columnist for TheStreet.com. Feuerstein discusses the growing controversy over drug pricing, the newsmakers of 2014, and lessons from the Dendreon bankruptcy. Adam, thanks for joining us.
Hey, it's good to be here, Danny.
We're going to talk about the year that was in biotech. A few days ago, I think I would have started at the front end of 2014 with the question of Gilead's hepatitis C drug Sovaldi and the controversy over its pricing, but let's start at the other end with a decision yesterday by the pharmacy benefits manager Express Scripts to exclude Sovaldi and other high-priced hepatitis C drugs from its formulary in favor of AbbVie's recently approved Vicaripac, for which it negotiated a special price, reportedly around $51,000 a year for a course of therapy versus $84,000 for Sovaldi. What should we make of that?
Well, look, I don't want to sound too alarmist, but I wrote this, I wrote a column about this, on the day that the whole Express Scripts AbbVie thing came out. I do kind of see this as potentially a sort of tectonic shift in the biotech industry, and not necessarily in a good way. And what I mean by that is we've worried about the sustainability of drug pricing for a very long time. It's something that everyone has talked about, but sort of kicked the can down the road and not really, we talked about it, but not really worried about it, and it hadn't had a demonstrable impact on the sector. And I think the Express Script thing is the first time where we saw a truly innovative drug, right? I mean, I think no one argues that, we can argue about the price, but no one will argue that Sovaldi/Harvoni are true innovation, right? We're talking about, curing hepatitis C with a single pill taken once a day, 12 weeks. And for the first time, a health plan, a PBM has said, we're going to restrict that. We're going to kick that off our formulary because there's another equivalent therapy that we get cheaper. And that is just, to me, that's just an amazing event. And I think that sort of brings the whole drug pricing question, like, it just slaps us in the face, right? And now, and what I wrote is that I said in the past, investors would when they met with biotech executives, they would say, what are you going to price your drug? How are you going to price your drug? And I think the question now becomes, what will PBMs or health plans allow you to price your drug? I think that becomes the new question, and that introduces a lot of uncertainty into the sector moving forward.
Well, Gilead, which has been a stellar performer largely because of Sovaldi, which shattered expectations, a record launch for a drug, fell 13% yesterday. If you think back to March and the point where the market broke in the beginning of the year, it was when lawmakers raised questions about pricing of Sovaldi and triggered fears among investors of price controls and similar measures. Are we going to see Express Scripts' decision here reverberate more broadly through the sector? And if so, how broadly?
I think that a lot of that depends on the follow through, right? So you're right. So the market dipped in March, and part of that was because Congress was making a big stink about this. But I think the difference between that and what we've seen today is while Congress talked a lot about it, they didn't do anything, right? There's no follow through. But Express Scripts, if you look back, they said a year ago, look, this is a problem, and we're going to do this, and they just did it, right? So that's kind of where maybe this is a little bit different, and a little bit we should take this more seriously, because unlike Congress, which is do nothing, and nobody really takes them seriously, the private health plans and the PBMs, they seem willing to actually take this issue on and do things about it. So looking ahead, I mean, you hear this guy Steve Miller, who's the chief medical officer for Express Scripts. He's like the most widely interviewed guy in healthcare in the last couple of days, right? He's been everywhere talking about what they're doing. He said, right? He said, look, this is not just about hepatitis C, but we're looking at RA, we're looking at other cancer, we're looking at other diseases where we may be able to do similar things. So let's see what he does, right? Let's see what happens looking forward, and whether we see these kinds of situations take place in other disease areas with other companies.
Well, there was an argument being made around hepatitis C drugs in particular, that payers would be able to drive pricing lower through competition. Mm-hmm. And there was, at the time, some case from drug makers that they were not going to compete on price. But does the AbbVie Express Scripts deal suggest that this is how the price of specialty drugs will be controlled?
Well, I think it does, right? I think in certain situations where you have interchangeability, you have a lot of price you have competition. Those are the kind of things that you sort of look for, where you might have these kinds of situations where a PBM says, look, you need to come to us, you need to come with a lower price, or we're going to exclude you. Again, I think the thing that was different to me about this one was not necessarily the price discount, right? I think, look, we all know that drug companies negotiate discounts for health plans and through PBMs. That happens all the time. The thing that was different to me about this one was, like, not only that happened, and Express Scripts told Gilead that they're being frozen off the formulary, right? So there was it was the combination of the two that I think, to me, made this one more significant and different than what we've seen in the past.
Well, as you do this time of the year, you've gone through your nominees for the best and worst CEOs of 2014. Though not your winners, it's hard not to notice that several of them were heads of companies that were the target of big dollar takeovers: Prosenza, Idenix, and Intermune.
Right.
How much of a genius does being acquired make a biotech CEO?
I don't. I think part of one of the kind of criteria that I use for that award is the return the return on investment from a shareholder perspective, like how well did the stock do. So when your company gets bought for a hefty premium, you can turn to your shareholders and say, look, I made you a lot of money. So that's where that's why the Idenix guy, that's why Prosenza, they're on that list because for that reason, and that that's a certainly legitimate reason. It doesn't make them getting bought doesn't necessarily make anybody a genius. There's obviously luck involved, and other things. But I think that's kind of part of it, right? It's just it's you're getting the bang for the buck if you're a shareholder.
So the winners were a shared pick: David Shekine and Nick Leschly. He's not the guy that dumped Jessica Simpson, right?
No, Nick Leschly, right, and David Schenkein, exactly.
Yeah, CEOs of Agios and Bluebird Bio. What's the rationale in linking them as a single nominee, and why did they deserve the nod?
Well, it's funny, when I was coming up with the nod, and they were both going to be on the list either way, and then I thought, it would be funny to kind of put them together. First of all, they go way back. They have they each worked at one time. They worked at Millennium Pharmaceuticals. They sit on each other's boards. They're very close friends. There's a lot of sort of interpersonal and sort of business connections between the two of them. So I kind of linked them together. Plus, I think that the two companies, Agios and Bluebird, I think are both really are representative of kind of this new class of biotech company that's come out in the last couple of years. Those are both relatively recent IPOs. They're doing things. I think they're undertaking drug development that it's really sort of has the potential to be, kind of game changing. If you look at a company like Bluebird, which, has sort of resurrected the gene therapy world. And what we're talking there potentially is, curing disease through gene therapy, which is, a pretty amazing thing to do. So, and Agios, is kind of doing the same things with cancer, kind of, looking at cancer metabolism and sort of the genetics of cancer. So that's why I sort of put them together, in sort of one nominee. But both of them, even separately, both of them are very deserving of the award.
So I got to say, on the worst CEOs, the list of nominees, it was a colorful list with a tinge of the bizarre.
It's always that way.
Well, not surprisingly, it seemed to be driven by bad decision making, but not so much in the Wharton sense, more like the ABC After School special. Any pattern or theme there?
I think that list. Again, I sort of have fun with the worst CEO list. I think that there's bad decision making. There's inexperience. There's immaturity. There's always sort of a level of, for some of them, it's always sort of a level of flim flam, that goes on with some of these companies. And we all know that for every great biotech company, there are more than a few companies that just really are not deserving of being sort of investment worthy and sort of exist just to they seem to exist just to sort of keep the paychecks flowing. So I think that I try to sort of recognize those CEOs on that list. And there's an abundance of candidates every year for the worst CEO list.
One story that was more like an exclamation point to an older one was the Dendreon bankruptcy. A remarkable place for a company to end after bringing a breakthrough cancer therapy to market. Well, what's the lesson from that?
Well, I think the lesson there is that is that you need more than sort of innovation and a technological advance to become a successful company. There are we sort of forget that we don't talk a lot about manufacturing and delivery issues and things like that. They're not sexy. But they're very important when it comes to running a successful business. In the case of Dendreon, they ran into mistakes they made, ran into problems with whether it's pricing or, again, delivery, manufacturing, the cost of manufacturing. That was one of the big issues there, is that that company's COGS, they could never really get to the point where they could provide for the profitable product to produce. And so all those things, we investors and people who look at biotech sort of tend to maybe not focus on those things as much. But Dendreon is a good lesson in that those things are vitally important.
One of the biggest healthcare stories in 2014 was the Ebola outbreak in Africa. I think one of the surprises here is the pipeline the biopharmaceutical industry had in process, largely thanks to worries about bioterrorism. Do these drugs and vaccines get developed, and will investors care?
I think those are two separate issues. I think that they do get developed because this Ebola outbreak was one of the worst we've ever seen, and it seems like there is enough impetus now, both from a sort of a public health and even from a sort of a private foundation, the Gates Foundation and et cetera, who feel, I think it seems like now there's been some kind of tipping point where now it's all right. We need something. We need a vaccine. We need drugs to treat this disease. Will investors care? I don't know. I don't think so. I mean, I think they care when it's in the headlines. It's a sort of a momentum thing. It's a headline-driven thing. Is Glaxo or any of these companies that are developing Ebola, are they going to make a ton of money selling an Ebola vaccine? I would say no. I think it's I think it's kind of a blip in that respect. So I don't think long-term, I don't think investors are really going to care about Ebola.
Well, we're going to continue our conversation with Adam Feuerstein next week. Take a look at the year ahead, the upcoming J.P. Morgan conference, and the companies to watch. Adam Feuerstein, senior columnist for TheStreet.com. Adam, thanks as always.
Hey, thanks, Danny.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send email to Danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.